Hello, everyone. Welcome to this webinar for the EDPM exam, the EFIC EDPM exam. This is your opportunity to find out more about the EFIC EDPM examination, how to prepare, what is included, how the whole process works. My name is Melinda. I'm from the European Pain Federation EFIC, and I'm joined here today by two panelists who I will ask to introduce themselves. Indra, would you please introduce yourself and tell us a bit about yourself?
Hello, my name is Indra Junger, and I am clinician. I am pain doctor, and I also specialist in physical and rehabilitation medicine. I'm working as a consultant at a multidisciplinary pain rehabilitation clinic in Stockholm at Danderyd University Hospital in Sweden. And during last years, I have been involved in EDPM. And during the last year, I am as well functioning as a chair for educational committee for EFIC. So you are very welcome to this webinar, and I hope we can give you information and answer to your questions.
Wonderful. Thank you so much. And now you, Daniele, please introduce yourself.
Hi, everyone. My name is Daniele Battelli. I am an anesthesiology and pain clinician involved primarily in pain medicine, palliative care in our hospital, that is San Marino State Hospital in San Marino Republic. I am involved in EFIC activities since 2009. I am involved in the EDPM since its first edition in 2017, and now I am the examination director for EDPM. So thank you everyone again for being here, and we will have a deep discussion about EDPM, how it works, and how and why to apply.
Exactly. So we're going to tell you a little bit about the EDPM and how it works. But then at the end, after the presentation, there will be time for questions. So feel free to ask any questions either in the chat or in the questions and answers module. Usually it's at the bottom of your screen. And then we will come back to that after we have gone through the presentation. Thanks so much. And I'll hand over to Indra now to tell you a little bit more about what the EDPM is.
Yeah, what is the EDPM? If we look at the letters, it stands for European Diploma in Pain Medicine. So we have this pain diploma, and we have exam for that. And the content of the examination is based upon the European Pain Federation pain curriculum for this exam. We call it the curriculum. So I don't know if you have looked at the curriculum. It's available at EFIC's website. If you haven't done that, please do that, because the exam is very much based on the points pointed in the curriculum. And the purpose of EDPM is to improve a standard of pain assessment and treatment, provide a qualification for medical professions to test the broad understanding of pain and its treatment, and harmonize understanding of pain across Europe, complementing national qualifications where available. Can I have next slide, Melinda? So the exam is structured in a way that we have part one, which is put like multiple choice questionnaires. It will be done in the virtual form. In coming days, you will have that opportunity. And they will have a certain amount of questions which you have to answer. And after part one, if you after completing that, and when you have passed part one, you can participate in part two. Part one is, as I said, it's virtual format. You're doing at your own place during digital advices, digital computer. And part two, it's done at physically at the place, So we announce for place where exam will take part two will take place, and they will have so-called testing of clinical skills to examine different pain conditions, and it's called objective structured clinical examinations. One part of part 2, where we have different stations with different pain conditions, and you have to show during a certain time, short time, how to investigate, how to talk with patient, how much to know about that condition practically. And another part of part 2, it's called Viva interview. It also takes place in person during the same day or the same occasion. It's maybe divided during 2 days, part 2 examination at the place. And during Viva interview, you will meet our examiners. We have exam boarder. And examiners, they will interview you from different pain conditions, what you call this description, pain cases of the patient, how you treat, and we can ask not only treatment but also investigation. We can ask all questions which are under pain curriculum, which is on the website. So, for example, clinical Viva for muscular pain condition can also involve receptors, can involve neurobiology of pain, and also, of course, treatment approaches and so on. So be very much prepared for these 2 parts, reading the pain curriculum. So there is also limit of time when you can pass this exam. So part 1 and 2 can be set consequently or within a 4-year window. It means if you completed part 1, you can apply for part 2 for the next occasion, or maybe you can wait. Maybe you don't have time, you can wait 1 year, another year. So, but you have 4 years window. And access to part 2 is granted after successfully passing part 1. And when you successfully pass part 2, you will get EDPM diploma in pain medicine. Thank you. Can take next slide. Daniele, do you help me?
Regarding, hi, yes, I am here. Regarding eligibility criteria, so who can apply for the EDPM diploma? What you need to know is that our diploma is open to all qualified doctors who routinely treat pain patients. We require a minimum of 2 years of personal clinical experience in treating multidisciplinary pain assessments and treatments. So the examination is for young doctors that are involved at least from 2 years of clinical experience into the field of pain medicine, or for more experienced physicians that want to apply it for their professional qualification. What do you need as a formal requirement are your medical degree and any other curriculum relevant diplomas, for example, diplomas of specialization, your curriculum vitae that must detail at least 2 years, as we said, of clinical experience in managing letter of support or endorsement from a senior colleague, from a head of your department, or from your clinical director. Please note that this letter of support must be written specifically for the application to the EDPM. What is required from you is also a strong proficiency in English. Remember that the examination is provided both for the theoretical part as for the second clinical and practical part in English. So you should aim to a strong English proficiency in order to have the minimum issues during your examination. All the documents that you have to provide for apply as a candidate must be provided in English. So if they are not originally written in English, we require you to provide a formal English translation of your documents so that we can analyze them and evaluate them. Next slide, please, Melinda. About the preparation, as Indre already anticipated, the preparation for the exam requires an in-depth knowledge of both theoretical and practical clinical aspects of pain evaluation and treatment. The foundation for the EDPM examination is the European Pain Federation Pain Curriculum that you can find on EFIC website, along with pre-reading materials that are collected for the EDPM examination and that are available as a recommended reading list on the EFIC website once you apply to EDPM. Also, many accompanying learning materials are available on the EFIC Academy education platform in the form of pain medicine sessions from our virtual summit. We, along with MCQ practice examinations that are also available on the EFIC Academy education platform, and an OSCE session educational video that has been built and provided just for the EDPM examination, also on the Academy education platform on EFIC website. All these study materials are suggested to you as a form of preparation for the EDPM examination, along with the skills and the knowledge that arise from your daily clinical experience and activity. Next slide, please. Why you should apply to the EDPM diploma? You can have many different substantial benefits from taking the EDPM diploma. First of all, you will have an enhanced professional recognition, since the EDPM diploma is rapidly growing and spreading and being recognized as a valuable title for your career advancement, and also it's gaining a recognition as a standard quality of care across Europe countries. So your EDPM diploma can both give you an enhanced professional recognition as well as global improvement in your professional impression, also amongst colleagues. We have a growing number of candidates that are enthusiastic about our examination, and that will be able to spread positive messages about the experience in taking our diploma. So we do hope that you too also could soon be one of our growing group of EDPM candidates and former diplomates. So we welcome any kind of question or doubt or help that you can need in this webinar. Thank you. Next slide, please. I think that we have finished the presentation. Yes, it is. And so we would like to thank you again, and we are open for your questions.
So I can see we have a first question in our module. As I said, please feel free to post your questions in the chat or in the question module. Question on if you pass the first part of the exam, how many chances do you have for the second part?
You have one chance for the second part after passing part one. So since we leave a good time window of 4 years for the part 2 examination, then we recommend any candidate to take his or her time to be fully ready for the second part that, as Indra said, is an in-person evaluation of both clinical evaluation and assessment of patients in the OSCE stations, as well as an oral in-person interview of an in-depth analysis of clinical cases in the second part of the practical examination that are Vivas interviews.
Okay, we have another question here. On the EFIC website, the simulation of EDPM is based on true or false questions, but you talked here about MCQs. Is it going to be true or false, or MCQs, or a combination in the virtual exam?
Each MCQ, and you will have 50 MCQs in your EDPM part 1. Each MCQ is composed by a STEM question with 5 possible responses that are each of the 5 answers true or false. You can have a mix of true or false answers for each of the STEM questions. So you will have a true or false answers with any kind of possible combinations of true or false correct answers. So if your question is if just one of the 5 possible answers that you find in each STEM is true or false, no. Each of the questions can be true or false in any kind of possible combination. So at the end of the examination, you will have to answer to 250 true or false questions. 5 answers for each of the 50 questions. I hope that I have been sufficiently clear. Please tell me if you need a more in-depth or clarification.
Yeah, I can take next question. Are we gonna get clinical cases or mostly theoretical questions? You can see if I'm answering right, Daniela. They're most theoretically questions, but maybe some of them can be based or can have some kind of implications for the clinical practice. For example, you have a patient with low back pain. What do you have to consider, which is most important? And then you have 5 questions, 5 opportunities, and for these opportunities you have for 5 questions you have 2 opportunities. So for 5 questions you have 10 opportunities to answer and to show if it's right or false. For example, if can you have a patient with chronic low back pain with no radiculopathy, and his question is can you treat with as neuropathic pain, for example, which maybe it's false. I mean, you have to have some clinical knowledge of that as well. It is why we want to have a clinical experience in working with pain patients, but MCQ is mostly for theoretical part to see the knowledge. Questions on, for example, neurobiology, on taxonomy, on investigations, on drugs, on receptors, which are not so deep or so detailed, so broadly covered during the clinical part of examination, where you will have mostly clinical skills examinations like investigation of the patient, or in Vivas go to the deep thinking, what you think about certain pain conditions, for example. Okay, can we take next question? Can you take it, Daniela? Next from Mina Habib.
Okay, yes. So not passing part 2 will make it obligatory to re-enter part 1 again. If you fail part 2, you can, within the 4-year window, take another one, the part 2 examination, but you will have to pay another fee for part 2. So once you pay your fee for the part 2 examination, you will have just with that subscription, just one chance of taking your part 2 examination. You will need to subscribe again for EDPM part 2. You can do it within your 4 years for 4 years window after part 1, but you will have to do another application for part 2 since the beginning.
Okay, and I can take a question from Anna Maria Spagna in the chat. Since the PAIN curriculum is quite wide and we don't have so much time to prepare, do you suggest us to focus on more specific subjects like neurophysiopathology, pain invasive procedures, etc.? Yeah, it's not so easy question to answer. It's when preparing for MCQ questions, we usually ask our examiners from the examination board to send the questions. So our examination board have different pain specialists in terms of the basic specialization, for example, anesthesiologists, neurologists, rehabilitation medicine. So the questions they can be built differently in terms of how deep they will be regarding the details. But as you say, the EDPM PAIN curriculum is very broad and it's not so much specified. It means that some of the questions, they might be specified, very specific, but they are covered under, for example, subject for receptors or for neurobiology of pain or the taxonomy of pain, and then the questions maybe they would be more detailed. What do we mean by having practicing 2 years? That is very important. It will allow you to somehow to know what details in this or curriculum, PAIN curriculum subheadings are most important. Otherwise, it's difficult to have a very detailed PAIN curriculum. But when you're working in pain medicine, you can somehow know or feel or understand that some parts are more important than other parts, and the exam questions are built in that way, which is most important. But of course, it could be very specific questions, which are you supposed theoretically to know, but maybe you don't know in practice. And it is always like, dilemma. As a pain specialist, you are supposed to have skills for different pain conditions, at least some skills for anesthesiological part, if you're not an anesthesiologist. Some parts you have to know for neurological part, neuropathic pain conditions, receptors, and maybe even for rehabilitation medicine. But we have tried to cover these parts in our academic platform, not fully, but we're working very much. We have reading lists. And the questions which are provided by the examiner board, they usually have a reading list already included and presented on the academic platform. Of course, to prepare for this exam, it's not enough to have some weeks before. You have to work during at least 2 years, as we suggested, and then to have continuous preparation, which maybe it takes time if you want to pass examination with high scores. I don't know how much I answered the question, but we are very concerned about that this exam, the candidates, it might be from different specialties. So we try to avoid very, very specific questions. For example, maybe very specific questions for invasive procedures, but we cannot not to have them. We have them, so it's always a discussion when we creating the our questions for examination. I don't know if you have some comments, Daniela.
Yes, about that, what I think that we can add is that you will never, for example, because in the question was written focus on invasive treatments, what we may require you is the knowledge of how and when a specific interventional treatment could be indicated. Maybe what it does imply, but for this kind of ultra specialistic arguments, we will not go too much in detail, for example, in extremely specific technical details. What we may require to you could be, for example, the knowledge of different evaluations and the treatments, also from the neurological or from the rehabilitational medicine point of view, but without requiring too in-depth knowledge of technical issues that can belong to a specific professional qualification, while many participants can come from different disciplines. So we require to you to have a broad knowledge of multidisciplinary intervention, treatments, and aspects of pain evaluation and treatment. But there is no need to know extremely technical details that belong to specific supra-specializations.
I can also add to this question, because, for example, I am working, or I know at least how pain medicine is built in Sweden. It's one country, and in Lithuania, it's another country. I'm originally from there, and I see very big differences. For example, in Sweden, we do not use so many invasive procedures for pain relief in our pain clinics. And in Lithuania, it's opposite. There are a lot of invasive pain procedures, but not so much multidisciplinary pain intervention, team-based rehabilitation. But you have to know some knowledge you have to learn, even you don't use them in your particular country. For example, in Sweden, I know that I don't have so much knowledge about invasive pain procedures, so I need to read that more maybe when preparing for examination. And this arises in another country where there are a lot of interventional treatments, and there are not so much team-based multidisciplinary pain rehabilitation. So I have to learn more to have more time for that issues, because we combine. This is our purpose, somehow to harmonize pain medicine through Europe, and to have somehow standard requirements which we're working for implementation in all European countries.
Okay, thank you both so much, and thanks to all the questions from the attendees. This is your chance to ask anything else about either the eligibility criteria, the first part, which is virtual and is taken on our education platform online, or the second part, if you want Daniele to walk you through how one of those OSCE or VIVAs, how that works and what exactly will be asked of you. This is your chance now. So we have a question here about the score we need to get. Which is the score we need to get to pass part 1?
You need to have at least a 75% scoring on MCQs of the EDPM part 1.
And then there's another question which is about how to prepare. So someone asks, is going through the Academy Education Platform subject, so the modules and all the sessions, the video sessions that are online, and the reading materials provided with the MCQ exams, is this enough to pass part 1? I know that's a tricky question. I don't know, Indra or Daniela, how you want to take it.
It's a very tricky question. What we mean, you have to have some kind of basic knowledge when practicing at your pain practice. This is your background. We're reading all applications sent for the examination, and sometimes we have discussion when people, they do not have 2 years clinical experience, but they may be in the endorsement letter is written that the candidate has very good skills and was meeting pain patients during maybe, you know, specialization time or like that. So what we mean that if you really work with pain patients during 2 years' time, you will have a ground, and that ground you should to build to improve by reading materials on academic platform. I think it's quite challenging to pass the exam if you do not working really in pain clinic. I don't know, daily or not daily, but you have, I mean, to having this background, clinical background, just reading the material on the academic platform. For example, I am educated, if I recently am educated as specialist in replacement medicine, and I didn't have so much time work with pain patients, but I want to have this examination, and I decided, okay, I read all material and I will pass. No, I think it might be difficult because the questions were formulated by specialists who are practicing pain medicine. They know the important parts. That you recognize if you have been working with pain patients, you recognize, you know what is expected, what is most important part in these questions, what is behind the question. So I don't know if it's good answer to my question to this question, but what I mean, you need to have a clinical background, strong clinical background, and then you read on the top of that, you go over material, recognize a part are new, so you learn the new things, and usually it should be enough. Do you have another opinion, Daniela?
No, I do extremely agree with you.
And then,
next question, how many times per year do part 1 and 2 take place? 1 time each. We will have next part 1 in a few days, usually in November, and 1 time each year, the part 2 examination, usually in the first part of the year, before summer.
It is right now, but if the number of candidates will significantly increase, maybe the examination opportunities will also be increased. But right now, during all these years, it was 1 part theoretical and 1 part clinical.
Okay, thanks so much. It looks like we've answered all questions for now. Thanks to the attendees as well for engaging and letting us know what is still to be discussed and presented on. As always, you know how to contact us, so please reach out to us directly if you have any follow-up questions. Our website has a lot of detailed information on the registration, the whole process, again, the full eligibility criteria, and as well as hopefully upcoming dates. We hope to confirm dates for 2025 very soon, so definitely watch out for that. I'd like to thank Daniela and Indra. Are there any final words from either of you that you wish to share with those who were in this webinar?
Good luck in participating in both part of examination. You're very welcome to do that. But as I pointed out, you have confidence. If you it's really time for you to take the examination right now, or maybe you still need to improve your clinical skills. You learn a little bit more. It's a tough exam, yeah, but it gives you very good confidence now that if you if you pass the exam, you know that you have quite good skills enough to work as a pain specialist.
Wonderful. Well, thanks again for everyone joining. Thanks to Indra and Daniele for telling us more about the exam. Have a great rest of your week. And as I said, you can find everything else on our website or contact us directly. Thank you so much, everyone.
Thank you. Bye.